Okay. Well, we didn't miss too much. Okay, so we'll get to discussion in there. Okay, so glad I realized that. Okay, so let me share my screen again. 1 minute. Sorry about that. Okay, so hide this down here. So what do we think? So I'm sure you learned this from your clinical faculty that you have. Always ABC. And whenever I tell students to prioritize their patient problems, always think about what's going to kill the patient first. What's going to do them the most harm first, and that would be your priority because we want to make sure that that doesn't happen. I'll let you guys open up the discussion and we'll talk about this for a little bit, and then I'll continue with the review for your test tomorrow. And I'll bring his case back up. So what do we think? What's a priority for him? So he has breakout, right? Pretty much all over. It has his arms, his legs, knees, abdomen, and scalp. Are we worried about like infection? Could he get an infection? That'd be my number one main concern for that, right? Because he has this all over his body. Do we have a skin integrity problem? Mm-hmm. We have impaired skin integrity. Mm-hmm. Yep. What else is going on?
Self-conscious about his appearance.
Yeah, so he has
by the long clothing.
Yep. So he has self-image problems, right? So he has a long list of problems, right? He smokes. He drinks on the weekends. So then let's go over here. Okay, so interventions. So we want to see him get treated, right, for his psoriasis, and more than likely that'll help with his psychosocial, right? If we get that fixed. He wasn't. You think he's beyond corticosteroids at this point? Probably. More than likely we could try some of this stuff, but I think he might be beyond the topicals because it's all over his body, right? So then maybe it could be these pills. When we don't have to worry about him being pregnant, right? If it was a female that was of childbearing age, that'd be a different story. Methotrexate, same thing. So we would anticipate that the physician's going to put him on one of these medications. Now, we would have to, if he would go on a cyclosporin or if he'd go on any of these methotrexates, this is a monoclonal antibody. I'm thinking that he probably wouldn't be able to drink alcohol with that. So we might have to do a lot of education, if that makes sense. And this would probably work the best for him to clear up, we'd have to look at the blood counts and liver function, see? So we're concerned because he's drinking on the weekends. So this would stop him from getting it if his liver functions were to the roof. They might go with something else that would be less likely to cause harm to the liver. That might be when they might go to the topicals, is if his liver functions were not right. But see, these are how decisions are made with a patient. So these medications here will depend on his compliance and his actual liver function tests. Because we all know, I have some LPNs here. Sometimes when patients say they're only drinking on the weekends, are they lying to us, you think? Sometimes they are, but the proof is in the lab work, right? Proof is in the lab work. So we could always tell by that. All right, so interventions for each nursing diagnosis. So we got our 3 nursing diagnoses. We're saying infection, skin integrity, and self-esteem issues. So what are you thinking about doing for this guy?
Telling them the importance of abstaining from alcohol because that increases a breakout.
Mm-hmm. Yeah, important because it could react with the treatments we want to give them. And, you know, this, you know, he might have to go with something that's not going to work as well for him. What else can we tell him?
I put like stress management because that can make his stuff worse too. And that might make him drink and smoke.
Well, that's good. That's good. Yes. Yep. Anybody get anything else? Did anybody put infection?
I did put a risk for infection because there was nothing stating that the infection was there yet.
Right. So risk for infection. Exactly. It would be a risk for. And typically, I don't usually, when I was clinical faculty, I would tell students, do not use risk with your top 3. But in the discussion, I'm okay with that. But just so you're aware that a risk is a potential problem, it's not an actual problem. So you would find something other than that for your top 3. But you know, for discussion board, we're going to be fine with that. Okay. Anybody else have any thoughts? I like this discussion board. I thought it was pretty straightforward. Okay. All right, so let's go, and I'm going to bring up my little, so I don't have, I don't want to bring up the actual test, so I took snapshots of it so that I could do a review with you all. So it's basically all about, were you able to watch my recording? Because I opened it public. Okay, so you were able to watch it. Did it seem helpful? Okay, good. So let's see. So give me a minute. I'm trying not to do this verbatim, so I'm trying to put it into other words, okay? So if you have a patient that you see has inflamed tissue folds, what kind of questions would you want to ask the patient? I might have asked this last week. It's around the nail folds.
The occupational.
Good job. Occupational. So, so what if you have a client that has a stage 2 or 3 pressure ulcer? What would you want to look at if you were concerned about an infection?
Drainage, odor.
So if you're thinking of pressure
White
ulcer,
blood cells.
what's that?
White blood cells.
Well, that would be one of them, but like, would
The depth?
you, so you're thinking, so remember when we looked at that website, remember what they were saying, like a stage 3, what you would see, like if you were looking to see that it was healing, what would you want to see? Let's go back to that.
Granulation.
There you go.
What'd you say?
What'd you say, Paula?
Granulation, it's where the tissue is starting to come back into the wound bed. It shows you it's healing.
Mm-hmm. Okay, so this is all, like, this is all about skin and talking about, like, so if we have a rash that someone finds under their breast, what would indicate that your patient has a good understanding, like, about care? What would you want them to do?
Use powder.
Very good. So you have a client that has a skin lesion. What would you want to do first before you go and assess this client? Very simple and basic.
Hand hygiene,
That's so right after hand hygiene.
glove up.
Very good. Good. Okay, so you guys got this. So, looking at your tests from the last time, it seems like medications were a big one for folks, and select all that apply. All right, so just kind of look at the meds. And I think if you guys play with that block chart that I'm going to put up on the announcements, I think that you're going to find that works out well. You're going to, and it'll stick for you too. Okay. Hold on one second. So if you were a nurse taking care of an older adult, what are some things that you would want to look at that would, if something was concerning, what would concern you in an older adult? Like if you were suspecting that they had like a suspicious mole, what would you want to look at? Don't forget A, B, C, D, E. A is for asymmetry, right? B is for borders. C is for color. D is for diameter. And I believe E is for equal. Okay. So when you're here, when they're talking about on this test, moles and assessment, you want to think of all those things, okay? And the size, the diameter should never be bigger than the eraser on a pencil. And the other big thing with moles is if they change in size, like quickly, like over a period of time, that could be very dangerous, okay? My daughter, I'm going to tell you a little story. My daughter, it's a while ago, she used to get tanning beds. And, just before prom, she never did tanning beds before that. But she got too dark. She went too much. And she actually was never, like, you could see I'm fair skinned and I burn. She's like, she has like Italian olive skin. So she tans, she would never burn. So nobody ever thought that she'd have a cancerous mole. When she went to have that, we noticed this mole on her chest in October, and it quadrupled in size by January. Okay. So, but it was like it had defined borders, and it still was not as big as a pencil eraser, but it just changed so fast. So I took her to the dermatologist and I was like, hey, you know what? Let's remove this just in case and have a biopsy. And I was like, you know, and the physician assistant even said, like, I don't think it's anything, but like, because it grew so fast, let's do that. You know, that it was atypical, and they said it was not normal, and that if we didn't catch it when we did, it would have been a full-blown melanoma. They had to bring her back and excise her muscle, that they had to go and make sure that it didn't spread into her muscle in her chest. So so yeah, that was a big lesson for us. And honestly, the only thing that was different with that one, it was fine according to the criteria, was the amount of time that it grew. It grew too fast over time. So just remember that, okay? Let me see here. Oh. Okay, so you want to know, and honestly, I've never heard of this. Lichenification. Just know what that is, okay? What is it? Does anybody know?
I'm sorry, what was the word?
I think it's lichenification. Lichenification. So just know what that is. That's just a knowledge question. That's not an application question. Oh, okay. So you have a patient that comes in and they were in a fire. What would you assess first?
Airway.
What's that?
Airway.
Good job. Yep. So what are some things you would do to implement infection control measures? What would you do to prevent infection?
Wash your hands.
Wash your hands. What else would you do?
PPE.
Yep, you'd wear your gown, especially, and you would wear, you would want to prevent fluids from touching anything. What else would you do? Really read those answers. When you're taking this test, read the answers. Read them a second time, okay? So you said some good ones. Would you use
Protect the wound with bandages, etc.?
What's that?
What, like wound protection?
Wound protection. Okay. What if they have a family member? What would you do? And they were on contact precautions.
Educate them about not spreading infection.
Yep. Would they have to wear PPE in the room?
Yeah.
Yep. All right. So what would you be concerned about if you're assessing your patient and you notice that their conjunctiva is pale? What would that mean? Like, what do we want it to be? We want it to be pink, moist, but it's pale. What makes it pink? Turn up So you're muted.
Blood?
Oh yeah, so blood. Okay, so what happens if it's pale?
There's
For
no
circulation.
Right. So then what are you worried about? What do you think you should check if there's no circulation as far as labs?
H&H.
Yep. Good job. All right, so if you have a patient that has an infection and now they've developed a temperature, they have an increased temp, what would you as the nurse do?
Perform an assessment, look for any sign of infection or sickness.
Okay. All right, so you would do that. What else would you do? What could you do as a nurse? What are your nursing measures? Your patient with the infection now has a fever. Do we think the doctor is going to have anything ordered for them in the chart? What do you think?
like Tylenol?
Oh, yeah, maybe. They might have that. So if it's ordered PRN, would you give it? Yep, okay. So you would do that. What else would you do? What are some nursing interventions? Did you give them a cup of hot coffee? What would you give them?
Ice water?
You would give them something cool, like cool fluids, right? Mm-hmm. What else would you do? Oh, go ahead.
Get everything off of them. Take the blankets off.
Yeah. Yep. Just remember something with this one, okay? You don't want to provide drastic change, okay? You don't want to provide drastic change. All right, now I'm going to leave you with that. A nursing manager, you're concerned about the number of infections on the hospital units. What would you do to help prevent these infections? We would call these people the police on the floor. Get a demerit. You're the manager. What are you going to do? You got all these infections going on. What are you suspecting?
Improper infection control measures and
Like what?
lack of education, lack of hand hygiene.
Not washing their hands.
Yeah.
All right. Okay. So, okay. So you have a patient that has a pressure injury on the right ankle and it doesn't seem like it's healing. What would you do? What would be the first? What are you worried about? They got it on their right ankle. It's not healing. So it's not healing. Well, I think about someone with diabetes, right? So what do we know about people with diabetes?
They don't heal well. They
don't heal well. Why?
Yeah.
Diabetes is the devil, by the way.
Yeah.
They have poor circulation.
So what do you want to do as a nurse? Poor circulation, you said it. What do you want to do?
Raise their foot off the bed.
Well, you can do that.
Elevate their legs.
But what do you really want to do? You're putting your hands on it. I always say this. You get your hands on the what? Get your hand on the
Prize.
close. Close. Begins with a P. You got it. Say it, Paula.
Pulse.
Yep. Check your pulse. Get your hand on the pulse. And so when you're thinking about the periphery, okay, anytime you have a wound in the peripheries, you always want to think of CPM. All right. When I was in nursing school, I would always use the acronyms to study. I would use like all these different naming systems to study. So CPM, circulation, color, pulse, movement. Okay. So when you're thinking of extremity and circulation, you want to think of CPM, circulation, color, and add another one, temperature, pulse, movement. Very, 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 I can't even stress this enough, very important. If you don't check those things on somebody who has an injury to their extremities, they could lose that limb. They have to have blood supply going to that limb or it dies. Okay. So remember that it is just so important. And remember when you're doing your diagnoses or anytime you're trying to figure out what's more important, trying to prioritize, always remember Christy Barnhart told you this. Think about what is going to kill that patient first. And that is the first thing I have to take care of because I don't want the patient dying on my watch. All right. So airway, breathing, circulation, rule of thumb. Okay. So is a pulse a circulatory thing? Yes. Is impaired tissue and skin in the extremities or wherever a circulatory problem? Yes. Impaired tissue integrity is a circulatory problem. It's not getting the blood nutrition to the extremity. That is ABC. Okay. So if you're not breathing, your heart's not beating, and your blood's not flowing, nothing else really matters, right? So don't say diarrhea or something like that if they have an ABC going on. Does that make sense? Does that make sense? All right. All right, so let's see. We have a nurse asks the supervisor, older adults are more prone to infection. Why is that? Why are older adults more susceptible to infection?
They have a slower response, a weaker response.
Everywhere, right?
Yeah.
Everywhere. Yep. And that's, if you know that concept, then you'll know how to answer this question. They have slower everything. So when you have an elderly patient, remember this. And you'll learn this is how many here going on for higher degrees after you're done here? All of you? Okay. So you're gonna keep going on and you're gonna learn more and more. So elderly folks, so you metabolize things in your liver and you excrete things from your kidneys. Okay. So older folks, they metabolize slower and they excrete slower. So they have, like a medication that has a half-life of like maybe 6 hours, it might hang on to an elderly person a lot longer. Okay. So a lot of times we might have to lower the doses for them. We have to be very, very careful how we're dosing our elderly folks. So just remember that as you move on into your nursing career. So let's go here. So we have a stage 2 pressure injury. Okay. After we discuss this, I'm going to give you a little clue. So what kind of dietary choice would you talk to this person about for healing?
High protein.
The answer is always chicken, okay? Just remember I said that. It's always chicken. It's never anything fatty or fried. Rarely is it beef or pork. It's always chicken, chicken, and chicken, okay. Let's see. MRSA. Okay, so we got MRSA. Okay, so what do we want to do about addressing for someone with MRSA? So you need to know about someone who has MRSA and care for them if they have a dressing or education that you would want to do. So like they're home, they're dressing their MRSA outbreak. What do they need to know? They have their family there. So what are some things that we need them to know?
Wash your hands, wear gloves, clean it with normal saline from the inside out.
Mm-hmm.
Wash your hands when you're done.
Mm-hmm.
I don't know. Don't let the dirty dressing touch anything.
Yeah. Like, would they shower or take a bath? Take a bath is gross. Let's bath in all the MRSA. No. So just listen, just read, like I'm telling you, read the answers more than one time before you select an answer, okay? Because you're going to be like, oh, okay, I didn't read that answer all the way. Okay. All right, so let's see here. So how do you know that an antimicrobial is effective? So we did a blood culture. We got the medication. So that would be what? We're given the right medication, right? So then what else? What else do we want to make sure we're doing?
Well, Paula, just say it if you're going to sit there and shake your head about it.
You're going to want to monitor that white blood cell count. And then if it's a wound, you'll check the wound to see if that microbe is gone.
Mm-hmm. What if we're given vancomycin or medication? So with vanc, what do we have to monitor with vanc?
Peak and trough.
Yep. So we want to make sure we're looking for peaks and troughs, and we're looking at all these things with the medication, that we got the right dose, and that we're treating the patient long enough. So we might have to do a repeat blood culture to make sure everything's okay. All right, so you have a patient with melanoma. So you might want to know about melanoma and like their treatment options, okay? So know that. You might want to know some of the medications that would help with scratching and rubbing on skin between fingers and wrists, like the little white. So you might want to know that.
I'm sorry, did you say between fingers and wrists?
Like
Okay.
you might want to know the treatment choices. So know how infection is transmitted. So if you have a client that calls you and says that he has a mole, a lifelong mole, and it just all of a sudden developed, it started to crust and starts to bleed occasionally, what would you recommend? They've had it a lifetime, it's just started changing. Think they need to be seen?
Better go to the doctor or have it removed.
Good job. So you might want to know about red raised patches that are covered with silvery white scaling. These are lesions. You need to know, are these contagious or not? Okay, so know that. So know which lesions would be more concerning. So if you have someone that comes in with multiple lesions, you're always going to be more concerned with ones that are irregular, that follow that ABCDE, okay? Irregular, asymmetrical, borders are not even, colors off, diameter is bigger than a pencil eraser, and the E. So know your ABCDE, okay? And then I think we are on the last one here. So know those medications that we were talking about with psoriasis. And if it's a young female patient, that some of those, before you put a young female on something like for psoriasis or one of these other skin conditions that are not, you're not supposed to take during pregnancy, you might want to ask them if they're on birth control and talk to them about that treatment, because if they become pregnant, they won't be able to take that med anymore. So those are things that you need to be aware of. Okay. So I will send that worksheet out to on the page for you. And is there anybody that has to meet with me afterwards today to remediate? No? Okay. You guys all met with me or Kristen? Okay. All right. So I'll hang back if you have any questions. If not, I'll see you on, I was thinking Thanksgiving's Thursday, so I wasn't going to be here. Would you all want to meet like on Wednesday or do 2 hours on Sunday? An hour on Wednesday, like at 7? Okay.
It's whatever.
You want to
y'all
meet
want.
earlier? Would you like to meet earlier, or you guys
It's
have
whatever
plenty?
they want to do.
Oh, okay.
I'll be honest, I won't be home on Wednesday evening, but I
That's
can
okay.
work later.
But that'll be recorded, right?
It'll be recorded. Yep. And then I'm going to put an announcement up for if hopefully everybody does well after watching the video on their test. I hope you guys all do really good. But if we have to remediate, I'm just going to have everybody meet with me following the Wednesday or Sunday class for remediation, or before. Okay, just to make it easier. All right, so if there's no questions for me, it was nice seeing all of you, and I'll get this video up as soon as I can. Okay,
Thank you.
Thank you.
you're welcome. Have a good day.